Hello everybody, Dr. Marianna here from SkinTock. So today I feel like I'm in my little mini chemistry lab, but thought we'll talk about the differences between neuromodulators like Botox and Dysport and Eusebia and fillers. So our dermal fillers, mostly hyaluronic acid filler based, the Juvederm family, Bellatero family, I use Restylane as well. So what is the difference? So we know that the action of Botox and neuromodulators versus the fillers is different. So this group of neuromodulators manipulates muscles, and this group of fillers helps to support the collagen layer of the skin. So with this, I can lift, I can fill, I can contour, I can shape. So a fun area of my day-to-day work that I have. So the difference, if you look at the textures and what these different products can do, is so neuromodulators, when they arrive at our office, they actually in this glass vial, and you can barely see this little powdery substance at the bottom. So we then have to reconstitute it so that it's in a liquid form. So then we add our sterile saline to the product, and then it becomes liquid. So this is then the neuromodulators that we inject. So I use a insulin needle that has these tiny little fine lines on it, and each line represents what we call a unit, and a unit is basically the international way that we express the volume or the dose that we use of neuromodulators. So as you can see, tiny little needle, and I draw up on here the amount of units that I need for the neuromodulators, and this is how I then inject. So on the other side, our filler group consists of a pre-filled syringe like this. So our fillers comes in a syringe, and most of the syringes have 1 milliliter of a cohesive gel inside of them. There is some products that has a little bit more and some that has a little bit less, but this is basically it. So if I use 5 of these syringes, it's 5 milliliters, which is a teaspoon. So imagine, me using a teaspoon of product in your skin. It's actually quite little, and I'm often just so thrilled and pleased when I can create what I want to create with a teaspoon of product. It's actually quite significant for me. So I thought I'll show you what these filler actually the consistency is, and I don't want to intimidate people. This is not the typical needle that I use to inject a face with. I picked one that's a little bit bigger so that I could potentially show you, I hope this is going to show up, the consistency of this filler. So this is what it looks like when I inject it, and I inject sometimes tiny little bits like this, sometimes a bigger volume like a little pearl that I put down. And as you can see, this consistency is a very cohesive gel, so it has elasticity to it, and actually this is how we get the lifting and the shaping with the consistency of this product. So the thickness of the product and how the product is put together also dictates the duration of the product, also how much you use in a certain area, and also where you actually inject it. There's certain areas of the face, like in the temple region, where these fillers will last for a really long time. So that'll give you a little bit of idea of what I do every day in my practice, and give you a little bit of a visual idea what is the difference between neuromodulators and dermal fillers. Take care till next time. So today's shout out is for Norwex cleaning products. I started using this during COVID when I had to clean my house with any help, and found these microfiber cloths amazing. I can clean most of my house with a couple of different textured products of Norwex without any other chemicals. Love that idea to have cleaner house with less chemicals. So try this out. They are expensive, but I'm hoping that mine will last for a really long time. Take care till next time.